This is Shad Reyes from Cardiovascular Innovations 2018 Denver, Colorado. With me is Dr. Jeff Shook. He's a podiatrist and he practicing in St. Vincent in Cleveland, Ohio. Welcome, Dr. Shook.
Thank you very much.
So tomorrow there is a full half day for limb salvage.
That's correct.
And it's a very unique setup. We didn't see it before. We collaborate between podiatrists and interventional cardiologists. How can you tell us more about this program?
It's one of the things that we've tried to do over the past several years is get involved with revascularization programs, specifically CVI. Dr. Mehdi Shishabor approached me and asked if we could put together a limb salvage meeting to kind of complement the critical limb ischemia track that they already have in place here.
Yeah. And so on day to day, when do you call for interventional cardiologists and how's your collaboration happen?
So one of the things, and we're about to do a lecture on this in a few minutes, one of the things is we kind of look at the 4 or 5 main things that cause amputation. Mm-hmm. And one of the main things is blood flow to the foot. Okay. And so any time that we see a patient that's in trouble with an ulcer or an infection or a combination thereof, gangrene, we almost always get vascular involved at some point to, at the very least, assess the patient and to see if they can optimize things. And in some instances, it's absolutely mandatory that they get involved in order to save the limb.
Perfect. And for follow-up, usually you follow the patient from the ulcer or wound standpoint, and the cardiologist will be taking care of that procedure itself.
Yes, and I think you kind of hit the nail on the head. The follow-up is really important with these patients. You have to have a very vigilant surveillance program, either with the interventional cardiologist or just by yourself to make sure that these patients don't get in trouble again. There's a high rate of recidivism with respect to these ulcers and infections.
Do you think we interventional cardiologists doing a good job referring patient timely to you when we see ulcers?
I think interventional cardiologists do a great job of getting patients to podiatrists and wound care specialists and people that are involved in that area of the body. And I think that actually podiatrists need to refer patients a little bit quicker to the interventional cardiologist to get the blood flow issue taken care of.
Well, interesting. Well, I'm looking forward for the session tomorrow. It's going to be a full day. And we're going to watch this session as well as this video on the Cardiovascular Innovation channel as well as the YouTube channel. Thank you so much, Dr. Shook, for your time.
Thank you. Pleasure.
And this is Shad Reyes from Denver, Colorado.